Yeah, so in this video we will be talking about the fundamentals of T1 and T2 weight MRI of brain. This is the most important topic which you will be tackling in your clinical practice. So we need to first know the fundamentals and very much basics, which side of the brain is affected, which side of the brain is edematous, which side of the brain is having hydrocephalus. So this is how we can approach the MRI. Before approaching the MRI, we need to first understand which things are appearing hypointense, which things are appearing isointense, and which things are appearing hyperintense. By this terminology, I mean hypointense means dark appreciation, isointense means intermediate appreciation, hyperintense means bright appreciation. So, in front of you on your screens are the two MRIs which are T1 weight T1 and this is a T2 weight MRI. This T1 weight MRI is also known as the spin lattice relaxation time, while as T2 weight MRI is also known as the spin relaxation. So you have two sequences in front of you, one is the T1 weight and another one is the T2 weight. So what is the major difference that you are able to appreciate? You can see on the T1 weight MRI you are seeing this region. I won't label it for you right now so that I don't make it more easy. So here you can see it as a black or hyper intense, and in T2 weight MRI you are able to see it as whites. So what things are appearing hyperintense on T1 and what things are appearing hyperintense on T2? This is the basic concept we should be knowing before approaching the MRI of a patient. So first thing to understand is on the T1 weight MRI, we see CSF and water as hypointense. Hypointense means dark. While as if we see the T2 weight MRI, we see CSF and water as hyperintense. So hyperintense means bright. If we see fat on T1 weight MRI, that will be appearing to us as hyperintense. But if we see the fat on T2 weight MRI, we will be appreciating it as hypointense. And hypointense we mean the dark pattern. So what are the appearances of grey and white matter? They are not the same. But they are different. So grey matter of the brain will be appearing grey, and we call it in the terminology of MRI as isointense. And white matter will be white on T1 weight MRI, and we call it in the terminology as hyperintense. How to remember the T2 weight sequence for grey and white matter? So T2 weight sequence will be the grey matter and the white matter will be showing us. The white matter will be hypointense. So if white matter is hypointense, that means grey matter should be hyperintense on T2. So white matter is hypointense on T2 weight image, and grey matter is hyperintense on T2 weight image. And which sequence is best for understanding the anatomy or the pathology of the brain matter of the patient? So T1 weight image is best for anatomy. So I remember this because T1, how I remember is, we had anatomy in the first year of MBBS. So in the first year of MBBS we study anatomy. So by this way we can remember anatomy is we can study anatomy anatomical description very nicely in the T1 weight image, but in the T2 weight image we can study the pathology very nicely, because pathology is in the MBBS second year. So we remember depiction of the pathology part of this of the patient, and for understanding better the anatomy of the brain parenchyma, you will be studying the T1 weight image. You will be studying the T1 weight image. So what is dark on both T1 and T2? So I remember it as cortex, the bone, will be dark on both T1 and T2. The hemostarin will be dark on both T1 and T2. The calcium will be dark on both T1 and T2. The tendon and ligaments will be dark on T1 and T2. Since we are here concerned about the brain imaging, so we will be discussing only the three parts. So we will be making two boxes and understanding which things are hyper intense on both and which things are dark on both. So dark on both T1 and T2, hyper intense on both T1 and T2. So dark on both, which things are dark on both? We said it's cortical bone. So we'll be writing with dark. So cortical bone is dark on both T1 and T2. Calcium is dark on both T1 and T2. Air is dark on both T1 and T2. Hemostarin is dark on both T1 and T2. So what is hyper intense on both T1 and T2? That is white, bright. I remember it as F square m raised to the power 4 and P. So F2 stands for flow, which is slow. Second F stands for fatty tissue or fat. For M1 is melanin pigment. For second M stands for methemoglobin, and you remember the methemoglobin is seen in subacute hemorrhage. Third M stands for any sort of mineralization. For example, copper deposition in Wilson's disease. And fourth M stands for contrast medium. And we know the contrast medium is gadolinium. P stands for protein rich fluid. So the things which will be appearing hyper intense on both T1 and T2 will be slow flow, fat, melanin pigment, methemoglobin, copper deposition in Wilson's disease, and this is also known as hepatolenticular degeneration. And mineralization and medium is the gadolinium and protein rich fluid. Dark things in both T1 and T2 will be cortical bone, calcium, air, and hemostatin. So in the next video I will be talking about the anatomy of brain on the T1 weight MRI, and also discussing some pathologies and investigation of choices, and what is the gold standard of investigation, what is the investigation of choices. I will be discussing it in the upcoming videos. So if you have not subscribed to my channel, kindly subscribe to my channel so that you get more videos like this. Thank you.